Welcome back to the Bliss Dermatology and Wellness channel. August is Psoriasis Awareness Month, and in recognition of that, we want to dedicate today's video to discussing how to take care of your skin day to day when you're living with this condition. So psoriasis is a chronic inflammatory skin condition that we understand to be a dysregulation of the immune system. The immune system sends faulty signals that cause skin cells to regenerate far too quickly. It most commonly affects the scalp, elbows, knees, and lower back, though it can appear anywhere on the body. And its presentation varies significantly from person to person. While there is no cure for psoriasis, it can be managed. Psoriatic skin is, at its core, inflamed and compromised. The skin barrier, which is responsible for keeping moisture in and irritants out, is disrupted, which makes the skin more reactive, more prone to dryness, and more vulnerable to external triggers. This means that products and habits that might be perfectly fine for someone without psoriasis can cause significant irritation or even trigger a flare for someone who has it. The guiding principles for psoriasis-friendly skincare are pretty straightforward. Prioritize barrier support, avoid ingredients that provoke inflammation, keep the skin hydrated, and be thoughtful about anything that causes friction, heat, or physical disruption to affected areas. That foundation in mind, let's walk through the recommendations. The cleanser you use is one of the most impactful decisions in psoriasis-friendly routine because it's the product that comes in contact with your skin most frequently and has the greatest potential to either support or disrupt the skin barrier. Avoid anything with sulfates, fragrance, alcohol, or harsh detergents. These ingredients strip the skin of its natural oils, compromise the barrier, and can directly trigger irritation in skin that is already inflamed. Antibacterial soaps and heavily foaming cleansers fall into the same category. They are too aggressive for psoriatic skin. What you need instead is a gentle, fragrance-free cream or oil-based cleanser designed for sensitive or compromised skin. Ingredients like glycerin, ceramides, and oat extract are beneficial. For the scalp, which is one of the most commonly affected areas in psoriasis, look for fragrance-free, gentle shampoos. There are medicated shampoos for psoriasis containing salicylic acid or coal tar. These can be helpful for managing scalp psoriasis and may be part of your prescribed treatment protocol. But as always, check with your provider before incorporating these, as they are best used under clinical guidance. Next, let's talk about moisturizers. So keeping the skin well hydrated reduces the scaling, minimizes itching, softens plaques, and helps maintain the skin barrier between flares. It also significantly improves the comfort of affected areas day to day. The best moisturizers for psoriatic skin are thick, fragrance-free creams or ointments rather than lightweight lotions. Lotions have a higher water content and often contain preservatives and additives that can be irritating. They also evaporate more quickly and do not provide the sustained barrier support that psoriatic skin requires. Creams and ointments stay on the skin longer and provide a more meaningful occlusive effect. Key ingredients to look for include ceramides, which directly support the skin barrier, colloidal oatmeal, which has a well-established anti-inflammatory properties and particularly helpful for itchy and irritated skin, shea butter and glycerin, which are deeply hydrating, well tolerated, and urea, which helps soften and gently lift scale in a non-irritating way. Equally important to knowing what to use is knowing what to avoid. Fragrance is one of the most common culprits. It's found in an enormous range of skincare, hair care, and body products, and it's one of the leading causes of contact irritation in sensitive skin. So look for products specifically labeled fragrance-free. Alcohol is one to avoid too. It's drying and disruptive to the skin barrier. Commonly found in toners, some serums, and certain cleansers. Best to avoid these. Physical exfoliants like scrubs, loofahs, exfoliating brushes can be aggressive and aggravate plaques, damaging the fragile skin. Harsh chemical exfoliants can also be too aggressive for psoriatic skin, particularly during a flare. You want to incorporate any of these ingredients. Do so only during periods of remission and with your provider's guidance. Hot water is another often overlooked trigger. Long, hot showers and baths feel soothing in the moment, but actually can worsen dryness, strip natural oils from the skin, and aggravate inflammation. Lukewarm water is always the better choice for psoriasis, and shorter showers are gentler than longer ones. Sunscreen and SPF is a non-negotiable part of any skincare routine, including patients with psoriasis. But the formulation matters. Many chemical sunscreen filters can be irritating and compromise skin. For psoriasis patients, we generally recommend mineral sunscreens, which sit on the surface of the skin rather than being absorbed and much less likely to cause irritation. Look for formulations that are also fragrance-free and free of added preservatives when possible. Beyond the skincare routine itself, there are several lifestyle factors that can improve psoriasis symptoms. Stress is one of the most well-established triggers for psoriasis flares. Many patients know a direct correlation between periods of heightened stress and worsening of their symptoms. Managing stress through whatever practice works for you, whether it's exercise, mindfulness, adequate sleep, or time outdoors, is an important part of managing this condition. Environmental conditions also have an effect on your skin. Dry, cold air can worsen dryness and scaling significantly. Running a humidifier at home, particularly in the bedroom, can help maintain moisture in the skin overnight and reduce the drying effect of air conditioning. Psoriasis is a systemic inflammatory condition, and for many patients, managing it well requires a treatment plan developed with a dermatology provider. Topical prescription treatments, phototherapy, and systemic or biologic medications can achieve results that skincare and lifestyle modifications alone cannot. So if psoriasis is affecting your quality of life, if your current routine is not keeping it under well controlled, or if you've never been fully evaluated, we encourage you to come in.